Having a good lactation program in place at your company has many benefits and reduces your costs. My guest, Kim Chelf, a community health educator from Cincinnati, Ohio, walks us through these benefits, ranging from the retention of experienced staff, saving money on hiring and training, saving money on healthcare premiums, and attracting the best employees in the first place. We discuss how you can implement a simple lactation program, overcome challenges of providing a lactation space, and how to schedule time for pumping in professions where there is a strict work schedule. We also discuss how getting colleagues and managers on board is vital to the success of the program and what arguments you can line up to achieve that. In the description below, we included a starter package that would enable you to start your lactation program. I will talk about this later at the end of the podcast. And now, enjoy the talk. Okay, I'm here today with Kim Chelf. Kim, thank you for joining me.
My pleasure to be here.
Today, we're going to talk about the business case for breastfeeding program, which was designed by the HRSA. And the point of this program was to show companies why it is in their best interest to implement lactation support programs. It has three main cost-saving aspects that they emphasize, and we're going to talk about this a little bit first. So maybe let's start with the first one, the retention of experienced employees. Research shows that with the good lactation support in place, the retention rate of moms who return to work jumped from 60 almost up to 94%. And that's very good. And I just wondered if you could give a bit more detail about the effect on the company and on the mothers.
Yeah. So one of the things that we know is historically a lot of women choose not to return to work after they have a baby for a lot of reasons. But one of them is if she wishes to breastfeed, it can be really challenging to go back to work and be a breastfeeding mom. And so the more lactation support a company can provide, the more likely it is that those moms will return to work and remain at work after they have their babies. And this is huge for companies because one of the biggest costs for employers is employee turnover. And so having to hire and train and onboard new staff can take up a lot of time and a lot of resources. It's much more cost effective to retain the staff that you have, especially if they're high quality staff, than to go out and attract new staff, go through the hiring process, all of the paperwork, all of the training, all of the onboarding. So that can be a huge cost savings for a company just in terms of not having to spend that time training a new person and getting them up to speed with whatever that company's, working policies are. So that's a huge one for the company. For the moms, it's also, a huge benefit because the last thing any new mom wants to be worried about is figuring out, how do I apply for jobs, do job interviews, get onboarded in a new company. If she is breastfeeding, those can be very difficult conversations to have with a brand new employer about, I need to express my breast milk. Where can I do that? This is the time that I need. Like those are conversations that can be very difficult no matter what the situation is, but especially if you're brand new, you're walking into a brand new job, a brand new position, brand new coworkers, brand new managers, all of that stuff. It's definitely not ideal. And then also, she might not be able to find a job that is similar to the one that she had in terms of pay or benefits or flexibility, whatever those, things were. And so the more a company can make it easier for moms to return to work and continue that breastfeeding journey, it really is very beneficial for both parties for different reasons, but very beneficial in both situations.
Right. And from the presentation, it also looked like that they also result in higher productivity, better commitment from the moms.
Yeah. And I think a lot of that boils down to, when your employees feel valued and cared for as a person and not just an employee, they tend to work harder for you, right? I think that's human nature. I know in jobs that I've had where I feel like my employer values me as a human and understands that I have a life outside of work, I'm much more willing to put in the time that's necessary, do that little bit of extra. And also, I think understanding that I know I have to be more focused. I have more stuff going on, so I'm going to be more productive while I'm working because I want to try to get that stuff done. I want to try to do my best. And so I think that goes a long way. And that's true for all employees, not just moms, but I think especially for moms, where we show them that we value them as a person and as a mother, and we think that that's important, right? That being a mother isn't a detriment to their job, but it's an important part of who they are and what makes them a good employee. They're going to stick with you a lot longer. They're going to stay, they're going to work harder, they're going to be much more loyal to the company than if you make them feel like a problem for needing to do these things.
That's very true. And maybe an additional benefit for the company is that if they have a good lactation program in place, they can also select from a better or an increased pool of skilled workers at the time of employment, because moms do consider the lactation program when they apply for a job or when they kind of decide for a job. So they might have better skilled workers in the first place just because they have a program in place.
Yeah, that's one of the things that I have talked to a lot of companies about is, if you want to attract good employees, you want to make yourself attractive as a workplace and get the best employees that you can. Obviously, the more benefits you can provide them, the better. And this is a huge one for moms. It generally goes along with also having a really good sort of parental leave policy and situation, especially in the United States, where that's not always a given. But I think when you have that whole package in place, yeah, it makes it very attractive for moms, and you're going to get to pick from the best of your applicants instead of having to lose out on a good applicant because they went somewhere else with a better program.
That's right. How does this argument stand up in jobs where there is not much training, not much accumulated knowledge required? Waiters, line workers, semi-skilled professions. What points can you make for those companies when it comes to valuing retention?
Even in those situations, there's still always a lag. So if you have an employee that, quits or chooses not to come back, there's still going to be a period of time where you have to go through that hiring process. Even if it's a quick one, even if there's not a ton of training that has to happen, there's always sort of that slow onboarding period where, even in a job where it's maybe a server in a restaurant or a retail worker on the floor, every workplace has different policies, different nuances, different things that, are unique to that workplace. And so there's always a period of time where a new employee isn't going to be as productive as an employee who's been there for a while. Even in quote unquote low skilled jobs, you're going to have that, not to mention the time that has to go into, having your managers and supervisors, read resumes and do interviews and, help the person fill out all of their paperwork that happens on the first day of employment. All of those things are, going to take up some time, and time in any industry is money, right? So if you have staff devoting time to those things, they're not doing something else because
That's right.
I don't know a single person who can do two things at the same time.
Except for moms.
But again, that's why you should hire moms, right? But yeah, so I think even in those jobs, you're going to have a benefit to keeping those employees. You're going to have employees that know your company, know your workplace, and can perform at a higher level without having to kind of wait for that new employee to get to that point, right? So we just want to keep those good employees.
And there is also predictability already with their existing dynamics with the colleagues, the customers.
Yeah. And I mean, in a lot of retail settings, especially if it's a smaller shop, you have customers that have their favorite employees, right? If it's a clothing store, you have someone who, I always go on Tuesdays because this person is there. I love to go to the pharmacy on this day because I love to talk to this person that's working behind the counter. So, you also have that aspect of it's beneficial for the customers as well to have those familiar faces and not to constantly be seeing new people coming in and out.
Absolutely. Absolutely. Okay, so that was one of the aspects. The second one was the lower healthcare costs. Could you a little bit elaborate on that?
Yes. And I think this is one that is sort of, I won't say uniquely important to Americans, but certainly has a bigger impact for us here in the United States, just because of the way our healthcare system is set up and our health insurance is generally provided by our employers. But one of the ways that healthcare works here is if your employer is giving you health insurance, they generally pay a portion of your premiums. And what portion they pay is based generally on how much health care your company as a whole used in the previous year or years. So if you have employees that are utilizing a lot of healthcare and racking up a lot of healthcare cost, then the company is going to have to pay more in those premiums in subsequent years. So what we know is that both babies who are breastfed and moms who choose to breastfeed tend to utilize less healthcare services because they tend to be a little bit healthier when we compare them to kind of the moms who maybe use formula or who choose not to breastfeed. And so over the whole company over the course of a year, that can amount to some pretty significant savings, which can help a company lower that healthcare cost, lower the premiums that they pay, and also not have to pass as much of that cost on to their employees as well, because there's usually a portion of that that gets passed on to the employees in terms of higher premiums that they're paying too. It can vary based on the size of the company. So if a company has more employees, one or two people utilizing a lot of healthcare won't drive those costs up as much. But if you have a smaller company, if it's a company with maybe only 50 or 100 employees, if you have one person or set of one family that's utilizing a lot of healthcare, that can cause the healthcare costs for the entire company to go up pretty dramatically. Probably less of an issue in countries where they have healthcare that's either provided by the government or heavily subsidized by the government. But certainly in places where there's private healthcare and employer-provided healthcare, that's a huge concern for companies.
You mentioned about how formula-fed babies tend to spend more time being sick than breastfed babies, and that's a big factor with the third argument, the third cost-saving element that the program is highlighting, which is the reduction in sick time. So the time the mom spends out being sick with the baby or with the sick baby, but it doesn't just affect the moms, it affects the dads. So what I wanted to ask really is, how much time are we talking about?
It's really hard to quantify, but I did my best to kind of do some sort of basic math and see. We know that studies show that moms of babies that are formula fed will miss work about 75% of the time that their babies are sick. And we know that moms of breastfed babies will only miss work about 25% of the time that their babies are sick, probably because a lot of the time those illnesses aren't as bad. Maybe they're less, they have a shorter duration. So instead of maybe baby being sick for a week or a week and a half, they're only sick for a couple of days. And so, they can jigger around with childcare and different things. I also know that most pediatricians will say to expect that an infant will have about one illness a month for their first 2 years of life. That's kind of the general sense of, you should just expect that your baby's going to be sick about once a month. It might be more often in the winter and less often in the summer, but over the course of a year, expect about 12 illnesses. And most of those will last about 1 to 2 weeks. So if we kind of take that as like a general sense, right? We would expect each infant to be sick for about 60 working days a year. So if we take 12 weeks, five working days, or 85 days in total, that would mean that a mom of a breastfed baby would miss about 15 days of work during her baby's first year of life. So that's about 25% of those 60 days. But a mom of a formula-fed baby would miss about 45 days of work during that first year. And one of the big things that we talk about is it's a lot easier to plan for a mom to take time out of her day to pump than it is to plan for those unexpected sick days when mom calls in and says, my baby has a fever today, I have to stay home. And now you're scrambling for coverage. So, you're looking at a difference of, 30 days over the course of the year, which can be, that's a lot of sick time. And of course, that's spread out with dads too, hopefully. When we know a lot of times mom is still the default parent, but it's getting much more common that dads are taking that time. But I mean, that's not chump change. You're talking about, 30 days, that's almost a month of work time.
That's very significant. And we might also add a few extra days on top, considering that if there's a sibling who might also be impacted by the baby being ill, gets sickness as well, that's an additional 6 days. So it's not really accounted for, but it's there. It's the reality of it.
Yeah. And or, oftentimes I know when my children were little, they would sometimes bring stuff home and then I would get sick. Right. So there's also that mom or dad can be sick from the baby. I know plenty of parents that have ended up with, things like hand, foot, and mouth from their infants, or, strep throat, different things like that. So yeah, all of that's also not accounted for in those numbers. That's just strictly looking at the baby. But there's a lot of benefits to not having folks be out on sick time.
Absolutely. Okay, so these are the three main aspects, cost-saving aspects. Now, let's look at what the company has to take on when they implement the lactation program. I must say, if you look at official documents and see how it's kind of defined, what a company needs to do, it does come across as a complex, big undertaking, which might make a company reluctant to implement it. But I think it really boils down to two main components. One of them is, of course, providing a space, and the other one is accommodating the time that mom needs to take out for pumping. So let's talk about these two big aspects, and then we'll talk about the rest of the things that they need to do, because I think it's more simple than it kind of might come across at a first read. So let's see the space. What are the basic requirements for providing a good lactation space?
So the basics, in terms of a space, it really just needs to be a private space with a door that locks, a chair, and preferably an outlet. But the outlet is even kind of optional because you can get battery operated pumps these days as well. But that's really it. And by private space, it doesn't have to be a dedicated space. I've seen work sites that use an office, that use a conference room, they use copy rooms, storage closets, library spaces. There's all sorts of options that doesn't have to be just a dedicated, this is our lactation space, although those are very nice. So it really just needs to be some sort of private space where the mom can lock the door, have a place to sit, and some place to plug in her pump. That's it. It's very, it's not that complicated.
That's right. And nowadays, you would also get these clever solutions where all of these requirements for the space come in one mobile unit. This is something I saw online, and I think it's fantastic because it might make things much more simple. It's like one mobile unit. It has the sink, the fridge, the power outlet, all incorporated. Easy to move it from one place to another. You can also just rent it for the time period you need it. So it's worth checking out. There are solutions nowadays that make it even more simple than it might come across on the first look. Okay, so that's the space aspect of it. The second one is the time, accommodating the time that mom needs in an 8 hours shift to breast pump. Can you please explain a little bit about that?
Yeah, so that's usually one of the major concerns for employers, right? Is how do we have employees that are taking all of this time to go express milk? And the reality is it doesn't have to be that much time. Every woman is different and every mom will need a different amount of time. But in general, what we're talking about is 2 to 3 20-minute pumping sessions per 8-hour work shift. And that'll change with the age of the child, with, the mom, the type of pump she has, the, how quickly she's able to express milk. There's a lot of variables there, but in general, what we're looking at is somewhere in that 60 minutes to an hour and a half per 8-hour shift. And some of that, and oftentimes I would say usually a good chunk of that is already break time that is built in, right? So I know labor laws are different everywhere, but so here in America, if you work an 8-hour shift, your company is required to give you 2 15-minute breaks and at least half an hour for lunch. So that right there is almost everything that a mom would need. So we're talking an additional 10 minutes on top of that, potentially, if we're looking at 20 minutes each time. So that's really not, surely to goodness, they can find 10 minutes out of a workday. That's not going to break the bank or cause major problems. I know for myself, when I was a nursing mom, it was about an hour and a half for me, just in terms of to get into the room, get everything set up, pump, and then get everything cleaned up. It ended up being about 30 minutes each time. And in the beginning, at least, I pumped 3 times a day. And then as my children got older, I dropped that down to twice a day and then down to once a day. So generally, there's also that piece that it will decrease in both amount of pumping sessions and length of time as the children get older. That's not always true for every mom, but that's generally how that goes.
Yeah. And there's also predictable when these pumping sessions happen.
Yes.
So there is a routine to it that we can rely on. I think one of the big reluctance here, of course, with the time is that they have to happen at certain time to make sure that we don't lose the milk supply. So they cannot be too delayed from the actual routine of what is established. So I can see that that might bring up a bit of resistance in companies and colleagues. What arguments can we do for companies or professions where the lack of flexibility doesn't allow for time scheduling, for example, schools, so teachers, hospitals, restaurants, bus drivers? Have you seen any good examples how they work out scheduling in these professions?
So yes, actually, sometimes what I've actually seen is in a lot of cases, the most successful programs are those that feel like they would have the least flexibility, because in those cases, a lot of times, if you have employees that are hourly, they already have those scheduled break times and meal times. And so just kind of maybe shifting those a little bit to line up with mom's schedule. And yeah, that might mean that the coworkers also get their stuff shifted around a little bit if you're in a situation where, can only have so many folks on break at one time. But in a lot of cases, that actually is fairly easy. I know my sister and I have a lot of family members who are nurses and have worked in like a hospital setting or a doctor's office setting. And it was the same kind of thing. They were able, because they actually already scheduled their breaks, they were able to just make sure that break schedule lined up with their pumping schedule. And, obviously that's a conversation you have to have with your employer and your coworkers to like make that line up. But it was actually fairly easy. Teachers are definitely one of the more challenging ones because clearly we can't leave children in a classroom unattended. And most teachers, have very limited breaks during the day. In some cases, I've seen that where if the school has sort of like a building substitute or a dedicated substitute for the building, what they would do is just go ahead and schedule that, that 20 minutes, that substitute would come into the classroom and take over while the teacher excuses herself to go pump. And then they would usually try to make one of those sessions during the teacher's planning period. One of the benefits for teachers is that generally their school day with students, at least here in America, isn't a full 8 hours. So most of the time they only have students in the building for maybe like 5 to 6 hours. So it does kind of shorten that. So a lot of them are then able to push that last pumping session to kind of like after dismissal, after they do, get the kids out of the building, and then they can pump, either once they get home or before they leave to go home. So that is a benefit, but that I would say teachers are probably one of the more challenging ones, along with potentially like servers and wait staff. That's another one just because of, if it's busy, but again, a lot of that has to do with being very kind of forward thinking, planning out, shifts, break times, trying to make sure that those pumping sessions aren't going to be in the middle of the lunch rush. Like you're probably not going to be able to pump at noon if you're working the lunch shift at a restaurant, because that's when a lot of people are going to show up to eat. But, making sure that, okay, if that's the case, I need to make sure I get this done before our lunch rush normally starts. and then I can pump after the lunch shift is over. So in general, I always just recommend that women work with their employer, have a conversation with their supervisor about what their needs are, and then what the needs of the workplace are. And there's usually some sort of solution. Even in situations where it's things like a bus driver, there's, like you said, there's a lot of great solutions these days in terms of things that you can do that are mobile. I've even seen, I believe it was in like farm workers out in California where they were in the fields and they were able to have like a temporary sort of, I think it was the shell of it was like a accessible handicapped toilet, like the porta potty, but it didn't have any of the inside part. They had made it into a lactation space. And so they were able to move that around to the different fields as the moms were like picking produce in different places. So whatever field they were working on that day, they would move that. And then they had that place to be able to pump, they could leave the field, go pump, and then go right back to the field. And so it was a minimal disruption for everybody. And the moms were super excited about it because it was just right there. They didn't have to spend 45 minutes driving to back to the office or, So, I mean, there's lots of innovative solutions. Every industry is going to have different challenges, but there's usually some way to kind of overcome those if you're creative and kind of think outside the box a little bit.
That's excellent. So these are the two main factors. And then you would read about how the company should provide education, resources, consultation to moms about breastfeeding. And this is where I felt like where a company might feel out of their depth, first of all. Second of all, it doesn't really feel like they need to do this. There are such great, excellent networks and advocacy groups out there who provide exactly that. All they really need to do is give them a list of these organizations that they can turn to. What are your views on this?
I think there's benefits to both. I think if you are in a place that has great support networks already, then absolutely refer to those organizations and to those networks and those people that are out there already. I think if, as is the case in a lot of places, at least in the United States, that either those networks don't exist or they're not super well known, then I think there's a great benefit to the company either having their own person that comes in or making an effort to make it super accessible for moms and dads. Because I think, in a lot of places, it's not as accessible, especially, if we think about folks who live in maybe larger cities or more urban areas are going to have a lot more resources than if you're, working in a manufacturing plant out in a more rural area. There's just going to be less around. So in those cases, the company might have to work a little bit harder to bring in some stuff. Whereas, if you're in a major city, there's probably already quite a bit there, and you can just provide a list of those resources, phone numbers, emails, whatever works for your employees. And I think that's something that just as an employer, you have to kind of evaluate on a case by case based on, where your work site is located, the resources that your employees have. So, if you're dealing with folks who maybe aren't native to the area and it's a lot of immigrants or people who come into work, they might need a little bit more assistance linking up with those resources versus someone who's lived there their whole life and their family's been there for generations and there's a lot of support. So I think you kind of have to evaluate on a case by case basis, but I don't think either one is a wrong answer. And oftentimes, especially for smaller companies, just referring out to the organizations and resources that exist is a much better solution than trying to kind of do it yourself.
Exactly. And it's something that you might be able to just start off with and then at a later stage expand it once you feel more comfortable with the established program.
Yeah.
One of the most important points for me, and it's something that is not so much talked about or addressed, but you did in your presentation, and I was really happy to see that, is that you need to prepare the staff, the colleagues, the supervisors, managers about this, because generally there is a sense like the success of the whole lactation program depends on how supportive the people around you are about this. And especially with the colleagues, if they have the mindset that the mom receives some sort of favor, they do some sort of favor for the mom, she gets a special treatment, that is definitely the wrong mindset to have here. And I wondered what are the best ways to prepare colleagues about this is not really just the mom's private matter here. This is something as a social responsibility. We all chip in, so to say. We all will have a role to play. And what are the good arguments that a company can make for their employees?
Yeah, I think this is one of the toughest parts. It's easy to say we're going to do this as a company, to look at the data and say, yep, this is what we need to do. It's a lot harder to get all of the other employees on board, especially if either they're older, they're sort of past those childbearing years, and they have that mindset of, well, I didn't have this, so why should you? Or, if they're younger and they haven't gone through that yet and they don't understand sort of how much time and effort it takes. But I think one of the things that is really important is talking about it. And not just talking about it with moms, but talking about it with everybody. The more we can talk about these things, I think the more normalized it becomes. And so I think a lot of times we put stuff like this in the basket of it's a woman's issue or it's a mom's issue. And it's really not. It's a societal issue, and it's important for society as a whole. So I think we have to talk about it. And I think we have to talk about it and talk about the benefits of it for both the company and society in a way that people relate to. So putting it into terms of cost savings, employee retention, the health benefits for babies that are breastfed, and how that can translate into having a healthier, better prepared workforce down the road. So I think we have to lay it out to the whole company the same way we lay it out to the president or the CEO or the general manager or whoever that decision maker is. And then I think, having moms and people who have utilized the program talk about why it was important and what it meant to them also goes a long way. It's one thing to look at numbers. It's another thing to hear from employees and people that you know and respect about how meaningful this was, how helpful it was. And, and again, I think a lot of times we kind of relegate all of this stuff around sort of childbirth, pregnancy, breastfeeding, child rearing to like this bucket of, oh, that's a mom's issue. That's not something we talk about. And I think we have to talk about it. I think we have to explain why it's important. What happens if a mom isn't given time to pump and express milk, and all of those challenges, whether that's her milk supply dries up, she can get mastitis, she can get infections. And I think for most people, when they understand both all of the benefits and all of the reasons that it's important, they'll get on board. I've also seen, companies that have great success with, explaining that, like, look, this is mostly their break time that they already get. So it's not that they're getting extra time. It's just that we're utilizing the time they're already being given, and, making sure that not just those moms are taking those breaks, but that everybody is taking the breaks that they're supposed to have. So if you're supposed to have an hour for lunch, make sure that everyone is taking an hour for lunch, and that you don't consistently have everybody else working through their lunch break while this mom is going off to pump, because everyone needs that break. And so I think that can go a long way as well. I've also seen, in places where smoking is still common, they'll liken it to, well, you get a 10-minute break to go smoke every 2 hours or whatever it is. This is like that, just for a different reason. Hopefully that's becoming less of an issue, because you can get into a whole thing about like smoking too. But I have seen companies that have a lot of employees that still smoke that have kind of put it out there like that of, well, look, this is how much time you're taking every day to go outside and smoke your cigarettes. How is that different than this mom taking this time to go feed her baby? So I think there's, again, kind of depending on your employee base and what that looks like, you can couch it in different ways. But I think talking about it is the key step, and being open and honest about what it really entails. Because I think a lot of folks think, oh my gosh, she's taking like hours a day to go pump. And it's really not that. But if you're not talking about it, it can certainly feel that way to folks who are just kind of looking at it from the outside.
Exactly. Who could just glimpse at it and then they make up the rest thinking about it without knowing the exact details of it. Also, I was thinking that the predictability about it, I think that's an argument as well for colleagues, because you can just easily imagine a scenario where you have the predictable pumping times in a day versus the totally unexpected sick leave where I suddenly have to cover for my colleague, maybe on a week when I have a deadline myself. So this might be an argument for the colleagues as well, that it's in a little bit in their own interest. And I wondered, another argument would stand or not, I would like to know your opinion about it, is that if baby gets less sick, there is less less pressure on hospitals with those babies. Would that also benefit, healthcare for others as well? So less waiting times in hospitals for other patients that might be your relative. So I think that's maybe it's a little bit far-fetched, but I suppose it's one of those factors that once you see all of these factors lined up, then you might have a better understanding and better acceptance of the significance of this.
Yeah, and I think that's very valid. And if there's one thing that the world has learned over the last few years with COVID, it's that, when our hospital systems get busy and get overwhelmed, it affects all of us, whether or not you're there for that reason. And so, yeah, I think, the more we can keep our children healthy and keep them out of the hospital, the better. And especially for young children, those hospital beds are very limited. That care is very specialized. And, if we can keep a baby out of the hospital just by breastfeeding, that opens up that bed for a child who has some sort of condition or an accident or whatever it is that, we can't prevent, right? There's always going to be those things. And so, yes, if that's your child that has maybe is born with some sort of congenital condition that needs that hospital bed, having that bed not being taken up by a child that, could have been breastfed and we prevented something, then yeah, that's a benefit to everybody. And it helps us all out.
Okay. I wondered, you have seen a few companies who have implemented this lactation program. These arguments, did they make a change in their attitude towards lactation programs?
Some of them did. Some of them were much more open to it than others. And I think usually the ones that made the biggest changes were the ones that had a champion within the company, whether that was, in some cases, it was a woman who either was breastfeeding or had breastfed in the past. In some cases, it was, surprisingly enough, just a man who felt like it was important for various reasons, sometimes because he had a partner that was breastfeeding, sometimes just because he saw the benefits of it. But that champion was really important because as much as we can do as public health professionals, we're coming in from the outside. And so having somebody within the company that could speak to people within the company as a peer and not as, a professional expert was super helpful. And that was probably the single biggest thing that made a difference, is whether or not we could find that internal champion for breastfeeding at the company. But there definitely were plenty that did choose to either enhance a program that they already had or develop a, lactation space that had previously not existed.
Mm-hmm. Very good. So thank you so much. That was all my questions, and it was very, very good to have walking through this together, because I think there's a lot of arguments here that might not be obvious for companies when they think about lactation programs. So thank you so much for your time, Kim.
You're welcome. It was my pleasure.
You can start off a lactation program with small resources. Draw up a lactation policy. Prepare your colleagues and managers based on the arguments that you heard in the podcast. Define a schedule for pumping, and rent a mobile lactation unit that will not require you to change any of your existing spaces. In the description below, you will find 3 tools to help you out: a link to a lactation policy sample, a link to rent a mobile lactation unit, and a list of existing breastfeeding support networks where you can direct your employees in case they need help with breastfeeding. If you provide this much, you already have a good lactation program in place, and you can reap the benefits that come with it. Last week, my guest, Dr. Katie Foss, talked about how much we need more representation of breastfeeding in the media to help normalize the idea that breastfeeding doesn't just happen at home and in the hospitals. In the TV shows, we need to see a variety of characters across age, race, ethnicity, social, economic background, breastfeeding in different locations like restaurants, cafes, museums, shopping malls. One of our listeners, Suzanne from New York, got inspired by this episode and sent in a few ideas where she could have imagined breastfeeding being included in a TV show or movie. I will read out some of her ideas. Could Forrest Gump have given his famous bus-stop speech sitting on the bench next to a breastfeeding mother instead of a nurse? Could Elastigirl in The Incredibles have breastfed baby Jack Jack in a way that it still stayed a family movie? The Dothraki in Game of Thrones, a simple, earthy culture where breastfeeding could surely happen out in the open. I totally agree. I appreciate you sending these in. Please keep the good ideas coming. Maybe some of them will be picked up by the media. Next Monday, we will return to the topic of normalizing breastfeeding in public. The Chichester University in the UK conducted a study that showed that seeing as little as 4 images of a mother breastfeeding in public already increases the acceptance towards breastfeeding in public. My guests will be Catherine Newell and Dr. Ian Tyndall. See you next Monday.